Dr. Fong, you do see children in your practice, is that correct?
Yes, I do.
Now, tell us, what should a mom do, or what should a mom not do when she has a newborn baby and kind of raises that baby all the way up to, well, when the baby kind of leaves the home in terms of dental health care? And as we know already, dental health care affects many other health matters. So I wonder what advice you have for moms on how to proceed with that new little baby.
Well, what I would recommend to the mother is that they definitely bring in their child to come see the dentist when the child gets their first baby tooth in their mouth there. So it's basically first year, first tooth. And so by coming in to see the dentist, then we can work hand in hand together with you, providing you with the information and to guide you on how to best dentally care for your newborn baby. At the time, we're not really truly seeing the baby other than maybe taking a look inside and observing and just seeing if there are any conditions there that we can help to bring light to you. And that will help the child in the long run, but more importantly, the mother has the information that they need to correctly care for the baby. It's usually not until they're about 2 or 3 years old. In my practice, the youngest child I've seen was 2 years old, in which they are able to come in. We can develop a relationship with them. We can take a look at their teeth, count them to check for if there are any dental concerns or issues that need to be addressed. Probably the most important information that I can give to a new mother is that it's best not to put your baby to sleep with a bottle, because if they have milk in it or juice, yes, it may appease and comfort the child to go to sleep with, but if it's allowed for that milk or that juice to just remain on the teeth, then over time that's going to break down the teeth and lead to rampant decay, which we call baby bottle caries. So we want to help to avoid that condition. And so by coming in early, even though the baby may not have teeth, our sole purpose is to provide you with the information and guidance to properly care for the child.
Got it. So because if you give the milk or the apple juice or whatever it is, it has sugar in it, it turns into acid, and basically you're soaking your teeth. So on one hand, we learn as we grow up, as we start going to kindergarten and school, that we got to brush our teeth because otherwise that whole stuff is sticking on it. And so if you give a baby a bottle, you're not only not brushing your teeth, you're completely soaking them for the whole night. But what would be a substitute? Would water be okay, to fill the bottle with water?
Yes, I think it's important to probably just fill it with some water. Most of the time, the children just want something in their mouth to give them comfort. So if you had water in there, that will be more than useful in trying to reduce that cavity action that you just described.
Right. And I think another, as you get that baby in, when they're more or less 99% of the time there's no work to be done. As you said, you count the teeth, you look, you see whether they are erupting relatively okay or whether there's something there. It's really to get the child used to the environment of a dentist, so that like the first time the kid goes there, doesn't see that drill spinning in front of his eyes and then go into the mouth, because, I mean, who wants that? Even us adults don't really want that, right?
That's right. I can just say that in my office, what we do is we encourage the kids to come in with their parents when their parents are getting their teeth cleaned. Because just like you said, the primary purpose for having that child in the office is just to get them acclimated to the dental environment. That way they can see what is inside the room, what is being done to mom and dad. So therefore, when it's their turn to come in to see the dentist, they already are familiar with the environment. And so therefore, it's a lot less stress to them. It's a lot less anxiety for them, as well as for the parents. So it's a win-win situation for everybody.
Right. Let me ask you another question. As the child grows up, 6, 7, 8, 9 years old or something like that, I really don't know, and the baby teeth, the first teeth, whatever it is, they start leaving and then other ones are coming in. How important is it? Because I remember my dad, he literally put a little string around. He made lots of fun out of pulling a tooth out with, whacking the door, hanging it on the door, and that was the end of it. Is there something you have to tell that should the baby teeth be taken care of and fixed? Why fix them, basically? Why do a little filling on, or whatever it may be? Why worry about them coming out or not coming out? I mean, they're coming out anyway eventually, so whether they need to be pulled now or a year later come out anyway, because they're not the permanent thing. What's your take on that as a dentist? What are we maybe missing there?
Well, let me first of all relate back to your example that you said that your father just tied a string around your tooth and shut the door and pulled the tooth out that way. Honestly, that's a very crude and uncomfortable situation to put a child through. And that's probably what led to a lot of anxiety for adults today.
It was quite loose. It came out nice. He could have just punched on it. He just made that as a, you do it yourself. Here it is, go. Hit the door and fill them in, and it was the right angle, right out different. My father's an engineer, so he but the point is,
still very crude though.
He made fun out of it, but he could just have, I guess, robbed it. But anyway, what's is that okay? Good overall? I mean, teeth missing, and then the new ones come in.
No, it's not good. If a child does have a small cavity, even though it is a baby tooth, it's very important to treat that tooth sooner than later, because if you allow that cavity, which may have been small, just from a visual inspection, it can penetrate deeper into the tooth and then eventually affect the nerve of the tooth. And when that affects the nerve of the tooth, that can cause an infection in the gum. What that does is it not only causes pain for the child, but it can affect the development of the permanent tooth. Going back to how I said it can affect the child and leading pain, that can cause the child to be uncomfortable. If it's undetected when they're in, let's say, first grade, kindergarten, first grade, then that's going to affect their ability to learn in school. Because why? They're trying to live and deal with the pain because the parent didn't know about it or is unwilling to treat it. And so it is important to take care of the child, help keep them just to remain healthy by taking care of the issues when they're small, even though they're baby teeth. But as I had mentioned before, it's the importance of taking care of it early, even though they're baby teeth, is so that way the development of their permanent teeth are going to remain healthy and stable.
What happens what do you mean by the development of the permanent teeth? Give us some example there.
Well, for example, if that cavity proceeds to infect the nerve of the tooth, then they're going to develop a gum issue where they have swelling and infection. And if that occurs, that can just develop or slow down the development of the underlying permanent tooth there. And so we don't want that. We know that the permanent teeth are the most important teeth that we can have in our mouth because we only have two chances. We have the early child teeth, which are called the primary teeth, and then we have our adult teeth. But once we lose those adult teeth, we don't have a third chance unless we decide to choose to go with dental implants. But if we can avoid that, it's better to stay with our own natural teeth.
What about the teeth? So, like if there's teeth missing, or sometimes I've heard that some children's, the baby teeth, they just for some reason stay in too long and then the other teeth cannot come back out. They kind of go sideways because the other one is still in it,
Yes.
Like a tree's growing. If there's, or sometimes when you do a little bit vegetable planting, if you plant too many carrots next to each other, you will realize that something is not right. They don't have space in between, and they
gets a little crowded.
They get crowded. Is it also possible that when a tooth is missing too fast and too early, that then the other tooth also, the permanent tooth doesn't find its way correctly, and that somewhere along the line the orthodontic bill becomes more if that isn't taken care of?
Yes, that's true. That's a correct observation. If a tooth has to be removed prematurely or is lost, then what happens is the other teeth, whether it be the adjacent teeth or a tooth above or below